Thank you, Dr. Quinn, for joining us. Tell us some of the other effects that you're seeing out there.
Well, as researchers have noted in the CDC report just as recently as July the 24th of this year, fatigue is the #1 lingering effect of coronavirus survivors. But in this report, as was noted earlier, up to 35% of individuals that recover from coronavirus have some lingering symptoms. And this basic study of the CDC was done on the healthier population. Most of these people didn't even go to the hospital, but they still had these lingering effects: fatigue, shortness of breath, cough, joint pain, chest pain. Some even said decreased focus, where they're not as sharp as they normally are, decreased smell, headaches, and the list goes on and on and on. So this is something that we really need to pay attention to.
Dr. Quinn, has this been going on long enough to where that some of these effects are beginning to wear off? I mean, do people think this may last the rest of their life, or what do you think? Is it going to eventually go away?
Well, here's the deal. Remember, we've only been experiencing coronavirus for less than a year.
Yeah.
So there's no way we can really know that right now. So it's kind of a scary scenario. Some of the theories were that a lot of it is due to the inflammation, because one of the side effects to coronavirus is inflammation, especially in the lungs. And then let's hypothetically say someone has underlying conditions such as asthma that has no exacerbations because it's so mild. But now with this inflammation, the asthma is re-exacerbated, and now they're having asthma attacks and symptoms. But the bottom line is something that we really need to look at and really study closely, because we just don't know right now.
Mm-hmm. And Dr. Quinn, I put the message out there on my Facebook and Twitter, just asking people what their symptoms are after they've recovered from this virus. And one viewer told me she's still experiencing headaches, nausea, aches and pains all over, and she even has a fever. What would be your advice to her as a medical professional?
Well, the first thing is always contact your medical provider and let them know what's going on. The medical provider, for each individual, they're going to know that person's history. And as I said before, inflammation is one of the main hallmarks that the researchers are looking at the most closely. And if you do have an underlying medical condition, inflammation typically will exacerbate that condition. That's why it's so important to coordinate with your medical provider that knows your history. But also, the researchers are noting that the remdesivir, which is the only medicine that's been FDA approved to help treat this coronavirus, probably wouldn't be very helpful in this case, because we've already recovered from coronavirus. We're just suffering from the consequences of coronavirus, which is hypothesized most likely to be the inflammation. Therefore, the anti-inflammatories would theoretically be the most beneficial, especially a lot of individuals with joint pain and headaches. These anti-inflammatories would be helpful. But for people that visit the medical doctor's office, in a lot of cases, we'll even go as far as to prescribe steroids, because they're going to be your very strong anti-inflammatory treatments.
Well, thank you, Dr. Quinn. Always seems like this is a disease we're always learning on the job. Thank you for joining us. Always good information.
Yeah, there's so many questions out there.
Yeah.